Hi, I'm Dr. Jesse Coates. I'm a clinical professor at Texas Chiropractic College. I'm also a private practitioner in Friendswood, Texas. The purpose of today's video segment is to demonstrate a very common procedure done in a chiropractor's office, that of the adjustment of the cervical spine, or otherwise adjustment of the neck. I probably do 10 to 15 adjustments a day of the neck alone. If you're looking at a 4-day week, that's about 50 a week. If you're looking at 50 weeks a year, about 2,500 times a year. And in the 20 years of practice, approximately 20 years of practice, I've probably done it 50,000 times. Okay, now the purpose of the cervical adjustment or neck adjustment is to improve the function of the nerves. There is a group of nerves that exit either side of the neck, coming through the shoulder out into the upper extremity on either side, and those nerves are the ones that drive the muscles that allow us to operate our upper extremity. With that being said, I'd like to go ahead now and demonstrate that technique to you. Essentially what we do is we make sure our hands are nice and warm. Then we come up behind the patient like this with them lying nice and comfortable. And we go along the spine looking for positions of the vertebra, checking the muscle tone. And then when we find a particular region that seemingly appears to be different than any of the other regions of the neck, then we go ahead and we set up on that region and deliver an adjustment. So we have the neck flexed. We go ahead and flex it laterally just a little bit, and then we just slightly rotate it until the vertebra stops. And then I take an index contact and I place it right over the vertebra that needs to be moved, and I just simply give it that little movement like that. And so the adjustment, as you can tell, is virtually painless, very little aggravation to the patient. Just takes a little while for them to get used to a new doctor. There are other techniques by which we can move the cervical spine. One of them that I wanted to show you today is what we call instrument-assisted adjusting. This particular instrument is just one of many, some that are mechanized, others that are manual, as this one is. And what we do is we take this little rubber tip, and where I use my index contact on the patient initially to give what we call a manual adjustment or chiropractic manipulative therapy, CMT, instead of using the index contact, I will actually use this rubber tip and the spring loading that's in this instrument to adjust the patient. I'd like to show you that way, if you will. So what I'll do is I will check the other side now. We're checking the right side of the neck, and I find a little spot on the right side of the neck there that does in fact need, it's not motioning or moving quite as good as it could. And then I bring her to the lateral flexion. I rotate just slightly, and then we're going to palpate that region. And I'll place this little instrument right there and stabilize the neck and adjust. Currently on the campus of Texas Chiropractic College, research is being conducted. I'm the primary investigator of that research project. We are interested at this point in time in getting teams or individuals from around the Houston area that would be interested in participating in that project. You may contact us here at the college. I'll give you that telephone number. It is 281-998-6064. And if you will leave your name and telephone number and indicate that you're interested in becoming a research subject, I'll be happy to get back with you as soon as possible. Thank you so much.